Debbie, can we start, Debbie? It's 5:02 now.
Yes, let's start with you.
Hi, good evening, all. We welcome you all to this live webinar with our expert graduate doctors. And we are glad that we are able to arrange this live webinar for the benefit of our own EGF community, and it is extended to all our friends and family members. There are a few general guidelines before I go further. Please, when you join, make yourself that you are muted, so that there will not be any disturbance to the others, and do not turn on your cameras unnecessarily. There's a second thing in Zoom that it will not divert any one of us when the session is going on. And the third one is we have a Q&A session at the end for 45 minutes, and if possible, we'll extend for some more time. We have collected a few questions from our own graduates and students, and we also have some common questions with us. So both Spurgeon and Dr. Vinod, they both will address the questions. And if there are any specific questions to you, please make sure that you are entering those things in the chat window. We will not be allowed to rise through the voice because of there will be some disturbances will be there. So we encourage each one of you to chat, to raise your questions through the chat window, so that it will be easy for us to moderate. So with that, we welcome you all once again without wasting much time. Can I ask who is there online? Can I ask Sam Abraham? Can you start this with the word of prayer?
Okay. Dear God, our Heavenly Father, we bless you, we worship you, we glorify you. Thank you, Lord, for this time that you have given us. It's just your grace that we are alive, Lord Jesus, and healthy at this time, while many are suffering, and many in our community are also suffering. Lord Jesus, we pray that you will help us so that we can listen to the doctors, have our own clarifications, and do all that we can to help ourselves, our families, and society and the country, so that, Lord, we will go by the advice of the experts and not by many things that we hear in various ways. Lord, please guide us. In Jesus' name we pray. Amen.
Amen. The session goes on like this. First 20 minutes, Spurgeon will speak with respect to this COVID, the challenges and everything, what exactly you had to do. Followed by, there will be continued session with Dr. Vinod. So after that, we have the Q&A session followed. So please park all your questions to the end, and definitely we will address all the questions. And also, if you are encouraged, make sure that you pass on these links. And YouTube Live is also going on currently, so please make use of this one. And with that, I just want to introduce Spurgeon, who is not new to our own UESI circles in Bangalore and Karnataka. Anna is the Deputy Director currently at Bangalore Baptist Hospital, and he is a designated director and CEO from the month of October. Anna is endocrinologist, and he did his UG and PG at Guntur Medical College at Andhra, and then he did his DNB in CMC Vellore, and his fellowship in UK at University of Aberdeen. Without wasting much time, I hand over the next few minutes to Dr. Spurgeon.
Good afternoon. Thank you for the kind introduction, Paul Kiran, and warm welcome to all the UESF family of Karnataka and beyond. I would like to introduce the other speaker for this afternoon. It is Dr. John Vinod. He did his undergraduation and post-graduation from St. John's Medical College, and he is currently working as a consultant in the internal medicine department, and he's also specialized in geriatrics and palliative care. And thank you so much for joining for this afternoon's session, Dr. John Vinod. Warm welcome to you.
Thank you, Mr. Paul Kiran, and I thank the organizers for welcoming here.
So what we are going to do this afternoon, I'm going to share a brief presentation about the vaccines, and I also like to share some thoughts about the COVID management. Later on, probably I'll be interviewing Dr. Vinod because he has been working with the COVID patients for the past 1 year at Bangalore Baptist Hospital. In fact, last year during the first wave, BBH treated close to 9,000 COVID positive patients. So there is a lot of experience, that Dr. John Vinod has, and he'll be sharing some thoughts. Later on, we'll be taking up all the questions, whatever you post to us. Okay. So with this, I'll be starting the presentation. I'll be sharing my screen. It's going to be a short presentation with only maybe 15 to 20 slides. I need the share screen.
Yeah, you can.
You already have it.
Yeah. Yeah. Sure. Yeah. Thank you. So I'm going to talk about the vaccines and the brief management, of the COVID infection, which has been, affecting almost every corner in this world. And currently, we are at the receiving end of the second wave, that we see in Bangalore and also in all the other parts of our nation. Now, why do we need to take COVID vaccine? There were many doubts, when it came to the point of taking the vaccine. Is it safe? Is it not safe? Is it going to be beneficial? How about the side effect profile? There are many questions about the vaccination. But currently, as of today, the pandemic that we are experiencing, COVID-19, has substantial morbidity as well as mortality. As of today, there were 151 million people who were affected with this infection, and 3.17 million deaths so far because of this virus ever since it started in the month of November 2019. Now, when you look at this one, we need to look at, the infection fatality rate. That means if you are infected with the virus, what is the risk of dying if infected with this virus? It comes to 1.15%. That means if 1,000 people are infected with the infection, there is a possibility 15 people can experience deaths. Is there any effective treatment? Not effective. Treatment is available as of now. Okay. But is it possible to, prevent ourselves? In that context, vaccines in general, they reduce the burden of the infections, and the benefits that we derive from the vaccine, they far outweigh the risk of having the COVID-19 infection. Okay, now I would like to, show these graphs. I do not know whether you will be able to understand, but if you look at the graph that I have projected on the screen, this is the data that was taken from the country called Israel. Okay. Now, Israel has been very proactive. In fact, the Prime Minister of Israel has paid extra amount of money to the Pfizer CEO and got the vaccine, and he vaccinated the whole people in the country, in their country. Now, if you look at the amount of the reduction of the infection, the amount of the reduction of the symptomatic COVID infection and the hospitalization because of the COVID and the severe COVID, we are able to see this, the graphs that were displayed on the screen. The blue one is the one which depicts the people, who were vaccinated And the red one, the above one, is the graph that is showing the people who are not vaccinated. More than 500,000 people in the country of Israel that were vaccinated with the Pfizer vaccine. So if you look at the difference, the way how the graphs are diverging, you are clearly able to see the risk of infection, the risk of symptomatic COVID infection, and the risk of hospitalization because of COVID and severe COVID is definitely less with the people who have taken the vaccination. If you have to translate in terms of the numbers, if you look at this one, it will tell you, there is 92% reduction of the infection, 94% of reduction with regards to the symptomatic illness, and with regards to the hospitalization, 87% reduction and 92% reduction of the severe disease. So there is a definite advantage for the people who have taken the vaccine when compared to the group are the people who have not taken the vaccine in terms of the symptomatology, in terms of the hospitalization, and even in terms of the severe disease because of the viral infection. Now, you might ask me the question, traditionally, if we have to roll out a vaccine into the market, it has to go through various phases, phase 1, phase 2, phase 3, and phase 4. After the phase 3, it is generally released into the market. Generally, it will take around 5 to 10 years on an average if a vaccine or the drug has to be rolled out for the general public. Now, how come ever since the viral infection started in November 2019, how come we are able to have this vaccine which is rolled out for the public more or less in a year's time? Now, the way how the vaccines are developed, okay, one method uses the classical platform, okay, other method uses the available platforms that are available, the viral vector or the mRNA or the DNA protein material. Now these are already available, and most of the vaccines they have used these ingredients which are already available. And because it is a pandemic like situation, government has given immediate permissions, and therefore they were able to roll out the vaccines so fast and so quickly for the availability of the general public. Now, I would like to share with you the Covishield and the Covaxin, because these are the two vaccines that are predominantly available in our country. Now, how about the Covishield? It is an adenovirus vector vaccine, inactivated. Now, the UK and the Brazil trials showed the efficacy of the vaccine was nearly 70.4%. Now, you might ask me, how about the mRNA vaccines like the Pfizer vaccine and the Moderna vaccines? They are much more effective. Of course, they are much more effective. The efficacy of these vaccines, the studies show more than 90%, but still it is giving the efficacy of 70%. So it is as good, as the other vaccines. It will definitely give some amount of protection for us when we take the vaccines. Now, this was an interesting slide. They looked at the real world data, in Scotland. They have given the first dose of the vaccine, and they looked at the people who received one dose of the vaccine. They looked at all these people, what has happened to them after 4 weeks of the first dose. Now, this is what the data has showed. 85% risk of the hospitalization has come down for the people who have taken the Pfizer vaccine. But with regards to the Oxford vaccine, that is the AstraZeneca, the Covishield vaccine that we are taking, that is available in our country, the risk of hospitalization fell by 94%, even with one dose of vaccine. This is a really good data. That means it offers protection for us. Okay. Now, how about the Covaxin? It is produced by the BARC Biotech. This is a whole virion inactivated, SARS-CoV-2 vaccine. It is developed by the ICMR and the BARC Biotech. It went through the preclinical phase 1 and the phase 2, studies were completed. Now, the ICMR says the efficacy of the Bharat Biotech Covaxin vaccine is around 81%. The immunogenicity is good. It was able to elicit, good T-cell response. Not much of a serious adverse effects were reported with this one. Now, under the emergency usage in a pandemic-like situation, the government has given the permission even before it was tested in the phase 3 clinical trials, looking at the situation in our country. Okay. Now, how about the side effect profile of these vaccines? Okay. Anaphylaxis with the mRNA vaccines, the Pfizer and the Moderna. Okay. The frequency is 1 in 100,000. For example, if you have an infection and if you're supposed to take the penicillin, what is the chance of developing the anaphylactic reaction? It is 1 in 50,000. But does it mean because you're going to develop allergy to penicillin, does that mean you are not going to, you will stop taking the penicillin injection? No, we will not do that. We will still continue to take that. But look at, the anaphylaxis with the mRNA vaccines. It is 1 in 100,000. So it is pretty much safe. There are a few cases of, mention of the Bell's palsy and one case of transverse phlebitis. And the latest concern that we are hearing in the newspapers is thrombosis with thrombocytopenia. That means developing blood clots. With the AstraZeneca vaccine, the incidence of the thrombosis or the development of the blood clots is 1 in 100,000 to 250,000. That means if 1 lakh people have taken this AstraZeneca vaccine, one person can develop, the blood clot. The proportion is very, very negligible. So therefore, I would strongly, suggest, if it is possible, you have to definitely take the vaccine because it will prevent you, from developing the symptomatic disease, hospitalization, and even being affected with the severe COVID illness, going to the ICU and the critical care being ventilated and intubated. Okay. Now we will talk about the management part of it. What have we, understood about the COVID-19? This is a new disease. At least now at this point of time, we have some idea about COVID, what medicines need to be given, how to manage. But if 1 year back, we were literally, in a confused state, how to treat, how to move forward, what is safe and what is not safe. Now, if you look at the management of the COVID infection, okay, this slide is very important. Okay, when you are infected with the virus, okay, initially you might develop high-grade fever. You might have, symptoms like myalgia, body pains, and all those things. This viremia or the viral phase, the response to the viremia, by our body, it will generally last for a week's time. As days progress, when you go towards the end of the first week, the viral response will come down. And then the second phase will start, what you call it as the inflammatory phase. Generally, the first week of the illness is not a dangerous thing because it was only the active replication or the multiplication of the virus in our body. We will have varied symptoms, like 80% of the people, they may not have any symptoms, 10 to 15% of the people, they have myalgia, body pain, and then different kinds of manifestations. Now, after you finish the first week, as you enter the second week, we see the reaction of the body to the virus that is there inside. You call it as an inflammatory phase. Okay. Now, this period is the critical period, and this period is the one which we need to be careful. Okay. Now, this is how we can divide, we can classify mild, moderate, severe, and the critical. Mild means you have only minimal symptoms like the fever. Sometimes they may have cough, they may not have cough. Moderate, they might have fever with the respiratory symptoms. If you do a CT scan, it might show having pneumonia, COVID pneumonia. With the severe, you might have the respiratory distress, you have the increased respiratory rate. The saturation now currently is less than 90, and the patients show a rapid progression if you do a CT scan or the chest X-ray. Severe is where you have the shock or the respiratory failure. Okay. Now, if you look at the mild COVID infection, how do you identify what is a recommendation, what you should do, and when do you need to seek the immediate help? So, mild COVID infection, Dr. Vinod, how do you diagnose? What are the symptoms that people generally can have?
See, most of them are mild, so they may have fever, body aches, headaches, fatigue. Many of them can also complain of this loss of taste and loss of smell. I think many patients have complained of it. So most of them are mild, so we advise them home isolation and they can take the medicines at home.
So 80% of the people, they generally have mild
Yeah,
infection.
most of them.
Some people, they may not even experience anything. As part of the family screening, if you check them, I can't
They may be
positive.
asymptomatic carriers.
So these people will be asymptomatic carriers. Okay. Now the recommendation for the mild COVID infection is home isolation and care. Okay. So what should be done, when people have the mild infection?
So as mild infection, if they have, we'll have to advise them home isolation. If one person is affected, it's better that they wear the mask at home and stay in a separate room, have their own clothes, the vessels, everything for them separately. And all the other members also should wear a mask 24 hours of the day, maintain social distancing at all times. And the regular medications like the vitamin supplements can help, but I think the moment they feel their cough or the symptoms are becoming more, they will need to get help.
Yeah. So in the mild infection, the most important thing is a symptomatic infection.
Symptomatic control.
For example, if you have fever, you have to take paracetamol. Paracetamol sometimes 500 mg and 650 mg may not help. So you have to take probably 1 gram paracetamol, and you can go up to 3 to 4 grams per day.
Yeah.
That means if you have continuous fever, you can take 1 gram of paracetamol every 6 to 8 hours.
Mostly we give once in 8 hours.
Yeah. So the maximum dose you can go up to 3 to 4 grams per day. Okay. Now, hydration is very, very important.
Yeah. So roughly we tell like at least to take at least 2.5 to 3 liters per day.
Yeah.
And if they have any other cardiac conditions, renal conditions, then we tell them to restrict their fluid intake.
So if you have the problem, kidney problem, or else if you have the heart failure, if you have a cardiac condition, it is better not to overload your body with more water, because there can be water, congestion inside the lungs. So on an average, around 2.5 to 3 liters. If you're young, not having any comorbid conditions, you can comfortably take 3 liters, because with high grades of fever, there will be a lot of dehydration. So hydration is another important thing, that you have to drink lots of fluids at the time of the infection, mild COVID infection. How about the diet? What are the things that you can suggest people with mild infection?
I think if they don't have any underlying conditions like diabetes, hypertension, they can have a healthy diet. So including like foods rich in fresh fruits, vegetables. They can drink like warm water if they want.
Yeah. So maybe fruits like the citrus fruits, which have a lot of vitamin C.
Yeah, they can have.
They can have. So predominantly you have to take nutritious and healthy food. Yeah. But if you have diabetes, and if you have hypertension, and if you have the heart condition or the kidney problem, you should be careful with the dietary restrictions that you usually follow. Okay. And then the symptomatic treatment, like if you have the throat irritation or the cough, they can take tablets like cough syrups.
They can take, yes, if needed. One more thing I want to add is like many of them are doing salt water, warm, hot water gargle, and they're actually burning the throat, and they're coming with those symptoms. So I think even warm water gargles would be fine, but do it in moderation.
Yeah, maybe you can do the betadine gargling.
Yeah, even salt.
Even the salt water gargling, but not very hot.
Yeah.
That will also give you symptomatic relief.
What we say for salt water gargle is it just tastes like tears. It's just mildly salty.
Mildly salty. Okay. And then you can take multiple vitamins, vitamin C and the B complex, you can take all those things again. The important thing during this mild infection, you need to isolate yourself. If any of your family member is having symptoms, it is better for them also to be screened. Okay. And you monitor your temperature and the oxygen saturation, during this illness. Before this is the oxygen, oxygen saturation monitoring. This is a pulse oximeter. So when you monitor with the pulse oximeter, make sure your nails will not have any nail polish, and your hands are not very cold. And then you apply appropriately and then monitor the saturation. For a normal person, what should be the saturation level like?
Keep it above 95. So if it's dropped, I think more than the saturation, we also need to see how fast the saturation drops.
Yeah.
So in case a person is 97 at home and suddenly they feel it's coming to 95, 2% drop is also considered significant.
So you basically look at the initial saturation and see
Yes.
how fast it is deteriorating. For a normal healthy person, it should be generally more than 93, 94.
94.
Yeah. Okay. So these are some of the things that you need to do. You need to quarantine yourself, you need to have strict hand hygiene and the symptomatic management, plenty of fluids, using paracetamol if you have fever, using the cough syrups or the cetirizine, saltwater goggling, and using plenty of multiple, you can use multivitamins, and then you can stay in contact with the treating physician and you can monitor the oxygen saturation and the temperature. Okay. Now, if you have this mild infection, you need to seek medical attention. If there is a difficulty in breathing, if you have persistent high-grade fever or severe cough, if it is lasting more than 5 days, a low threshold to be kept for those who have any of the high-risk features. What are the high-risk features, Dr. Vinod?
I would also include breathlessness.
Yeah.
Many of them feel labored breath, so I think they will have to do the breathing exercise. I think we are covering in the slides below. So as sir is telling, any of the high-grade fevers, after 5 days, if the fever is still not relenting, I think it's a time to be concerned. We'll need to see if it's because of secondary infections. Because part of COVID itself, we've seen patients spiking fever for almost a week without any secondary infection.
And that's one of the severe symptom. If it is persistently,
persistent, then we'll need to see, because COVID is one infection, but they can have other infections also. They can have urinary infections. So
sometimes people have uncontrolled diabetes, they can have secondary infection,
very much.
Yeah. So we will move further. Now, how about using ivermectin, doxycycline, budesonide, and all those things?
Yeah, there are very low evidence for using these.
Yeah.
I mean, including the vitamin supplements, the evidence is not great, but still we are.
There is no harm in taking vitamin C, vitamin D, and then other things.
So ivermectin, it's the drug which is newly come. So there are still studies which are supporting it, and there are some which is not showing much benefit.
Yeah.
So I think as evidence comes, we'll decide on those. Doxycycline is used as an antibiotic for secondary bacterial infection cover.
So taking doxycycline is not going to help your COVID infection. If at all, if you have the secondary infection, probably this antibiotic will
I think
help.
adding all the antibiotics on day 1 of fever, I think is a waste of the antibiotics.
So adding doxycycline for the mild infection, I think probably may not be really required. It is not going to do any magic. How about the treatment of the moderate moderate COVID infection? So how do we identify if the patient's respiratory rate is more than 24? I suppose the normal respiratory rate should be around 16 to 20. Okay. If it is more than 24, or if the person is having breathlessness or the saturation is less than 93 on room air, so this is the criteria. Probably we can think the person might be having the moderate infection. Now, what is the ideal thing that we need to do? If at all, if there is a possibility for the person, having a bed in any hospital, is good to admit, especially with the people who have elderly, who have diabetes or the hypertension or the cardiac illness, or as a person is having the COPD, lung disease. So these are the group of people it is recommended for them to be in a hospital setting. Okay. Now, how about the oxygen support and all the things? What do you say, Dr. Vinod?
So, as if the patient is becoming breathless, they're symptomatic, well, we first advise them to do the awake proning exercises. So, basically, they try to lie on the left side, then the right side, and then leaning forward, breathing through the nose and breathing out. It helps in stabilizing the oxygen and helps in opening up the airways.
Yeah. This is one of the important things that need to be kept in mind. What we can do, at home. Awake proning exercise. You lie flat on your bed. If you can Google on YouTube, you'll be able to get to see the videos how to do the awake proning. Yeah.
And I think it's improved. I would say 100% of the patients who've used it, I think there's some improvement in them. In spite of giving oxygen, their saturation improves much more. Coming to your oxygen, I think when the saturation starts dropping less than 94, we need to be aware that how much oxygen to give, how long to give. So awake proning exercises definitely helps them. And one more thing is all patients with underlying lung disease, like pre-existing lung disease, don't have a normal oxygen saturation.
Like the people who are chronic smokers, who have asthma, who have obstructive pulmonary disease, these group of
They may
people.
not have normal oxygen saturation, so they should not panic when they see the saturations like 91 or 92.
For example, in patients who have the lung diseases, the normal saturation is between 88 to 92.
Yeah.
That is a normal baseline saturation. So you should not panic for the person who have the respiratory problems if you find the saturation level of 88 to 92.
I would just add on to that, if they become
Yes.
more symptomatic or respiratory distress is there, and if they've already monitored the saturation and it's dropping further, then I think it rings a bell.
Yes. So in the moderate infection, it is better for the person to be in a hospital setting. Now we're in the pandemic season. There is so much of struggle to get a hospital bed, and that too with oxygen. So what can be done? So the best thing to start with is the awake proning exercise at home. That will definitely help. If at all it is possible, you can use the oxygen cylinder or an oxygen concentrator at home and try to give the oxygen at home. And how about the anti-inflammatory or the steroid medication?
I've seen very many patients being started on methylprednisolone, dexamethasone on day one of fever.
Yeah, that's an important point to note. We should not start the steroids on the day one of infection. In fact, if you start the steroids on day one, that will enhance
If
prolong
their oxygen is fine, and if they're starting on steroids on day one, trying to avoid a cytokine storm, you're actually increasing the viremic load on the beginning.
Yeah. So it will prolong the viral multiplication in our body, so that is no good. That's not good for us. So it is not recommended for us, for anyone to use steroids right from day one of infection.
Yeah. If they have hypoxia or breathing difficulty, the oxygen is going down. Now that would be the time when you need to start the steroid medications.
So you typically can start the steroids like the tablet dexamethasone, maybe 6 milligrams once daily. So what are the precautions that you would suggest when the person is on dexamethasone or steroids?
I think sugars are the main concern because sugars and the blood pressure can be increasing. But as I told, we are giving the steroids for a very short period. It's only
maybe for 5 to 10 days.
5 to 10 days maximum, and then we stop it.
Yes.
So there's no plan for reducing the dose and stopping. We can just stop it within 5 to 10 days.
Yeah. The common practice that we are noticing, number one, starting the steroids from day one, which is not correct.
Yeah.
And number two, they're continuing steroids for longer period of time. You know what will happen when people use steroids for longer period of time? Their immunity will come down. That's number one. And number two, their sugars can go up. For example, if the person is having diabetes, taking steroids will shoot up the sugars like anything. For the person who has diabetes, if they are on steroids, you need to monitor the sugars, and then most likely these people, they might require insulin for the control of sugars. And the third important thing for the person who is on steroids, they might develop gastritis.
Yeah.
Therefore, it is important for them to be on maybe omeprazole or pantoprazole daily, maybe a couple of weeks time.
I will not advise patients to directly start steroids by themselves. It's better they consult with some doctor and then decide when it's appropriate.
Yeah, definitely at home, in case your oxygen saturation is on the lower side, definitely it is indicated steroids not to be started.
Yeah.
Okay. Now, how about this, starting a blood thinner, the anticoagulation?
So that's what as per the Ministry of Health and many of the guidelines, once the patient is having hypoxia, meaning the oxygen is reducing, prophylactically, meaning we start on a blood thinner injection to prevent clots in future. So the other inflammatory markers, if there's a serial rise in the inflammatory markers, then the dose may be increased, but at least what we call as a prophylaxis dose, we start on one called as heparin or the enoxaparin.
So this decision of starting the anticoagulation, it is better for the medical personnel to be involved and appropriately guide about this one. Okay, make sure there is no contraindication for high risk bleeding. And the other important thing that can be done at home with a moderate infection.
One is called as the incentive spirometry.
Yes.
So basically, this is an absolutely a brilliant one. It's called incentive because every time they take a deep breath, one ball goes up, and the deeper breath they take, the second and the third ball can go. It's an incentive. So people feel motivated when they do the breathing exercise. So even every half an hour to 1 hour, if they're doing it 10 times inspiratory and make it upside down and do the expiratory, it helps in opening up the airways.
Yeah, you can Google in the YouTube and you'll be able to know how to use
This
this
is freely
incentive
available in
spirometry.
many places. So apart from the awake pruning exercises, they can continue the incentive.
So at home, apart from the awake pruning exercise, this is another thing which will enhance the lung capacity. You know, if you don't have this incentive spirometry, you can take a balloon, simple balloon, and start blowing and hold the breath for some time. That will enhance the respiratory capacity.
Yes.
So these are some of the important things that need to be done, that can be done with the moderate COVID infection. I think we will not deal with the severe infection. It is not possible to manage at home. They have to be in the hospital setting. Okay. Now, how about the monitoring part of it for the people who have the moderate infection or the mild infection?
See, from the blood test point of view, we can get a baseline blood test to see, like, as per the guidelines, every 48 to 72 hours, we can repeat it.
So what are the blood tests you would like to typically order?
The complete blood counts.
Okay,
including the
you order the blood
hemoglobin,
count where you see the hemoglobin, total count, and the platelets.
platelets.
Yes.
Then the CRP, it's called as a C-reactive protein.
So this is one of the inflammatory marker.
Yeah.
CRP, C-reactive protein,
LDH,
LDH,
ferritin,
ferritin,
and D-dimer.
and D-dimer. You know, maybe sometimes CBC, CRP, and D-dimer, these three tests are more than sufficient. So D-dimer is a test which will tell us the potential having the
Thrombus
of the developing the blood clots in the body. Okay, so every 2 to 3 days
It should be okay, sir. Yeah.
should be okay, you know, to monitor and then make a decision based on the blood test.
One more thing I want to add is many of them do the test on day one of the infection. And see, this is an infection, this is a fever. So these inflammatory markers are bound to go up.
Yes.
So if the cutoff is say 5, their reports will come as 7 and they panic. I think we also need to see the serial rise of the enzymes, then seeing a single value and then deciding, okay, this is dangerous.
And sometimes when you do the test on day one, you may not see any
You may
difference.
not see much difference.
So ideally, probably towards the end of the first week after day
I would
5.
say if they're on home isolation, maybe after 3 days, if they can get a baseline, it will be baselines better.
Yes.
If they're getting admitted, then based on the situation, we decide.
Yeah. So probably one blood test, this set a set of blood tests in the first week,
yeah.
maybe between 3rd to 6th day, or the 5th day would be better. Okay. So you advise complete blood count, C-reactive protein, and D-dimer,
And ferritin, LDH.
and the ferritin LDH if it is possible. And monitoring these tests, you know, once in 3 days or something like this will help us the trend if the C-reactive protein is increasing and the D-dimer is increasing, so that we can make a decision what medication need to be added. Okay. Now, how about remdesivir? There is so much of panic. There was one story, you know, one of our patients, they were found to have, you know, they were given the positive report. Okay. Out of panic, immediately they did not have any symptoms. They went to the CT scan center and they did the CT scan, and they, you know, procured the remdesivir and then injected it. Not how from where they got and how they injected, you know. Now, looking at the evidence so far, the remdesivir should not be used for all the patients. It is definitely not indicated for the mild COVID infection. It should be used only in select group of individuals, like moderate to severe disease, and people who are requiring oxygen, are the persistent fever kind of a thing.
At least within the first week, I think the benefits are most within the first week if they're having low oxygen saturation. As I told, many of them can have just fever going for a week. Subsequently, they develop the low oxygen. It may not help much after the initial 7 to 10 days. So I think there's a lot of panic. People are just buying it, hoarding it. I think that should be avoided. So the patients who actually need it, then they don't get it.
So in moderate to severe disease, and then requiring oxygen. And these people should have a normal kidney function test and the liver function test. And the typical dose that we start is 200 milligrams on day 1, and then the next 4 days, 100 milligrams daily. So this is not a wonder working drug as far as the evidence is concerned, but may be helpful in reducing the hospitalization. Okay. So don't panic if you're not able to get the remdesivir. If it is available and if it is indicated, it is good to do. But if it is not available, you should not panic and then try for this one. Okay. And how about the tocilizumab? This is another drug.
Tocilizumab also, I think a very select group of patients who can actually benefit from it.
Yes,
You can send what we call as interleukin levels, which I didn't
interleukin
mention.
levels and CRP.
So it should be very, I think the treating team will have to take a call on it because this is also under study. It's an off-label use, which is there. So it is very expensive and it's difficult to get also.
But the most important thing is, you have to give it at the right
Yeah.
period of time. The patient should not have any sepsis,
Yeah.
any secondary infection. The patient should be having inadequate response with the steroids.
Yeah.
And then if the interleukin levels are very high,
Yeah.
in those select group of individuals only, it can help the patient to a certain extent. So this is not a miracle drug, and this should not be given for every patient, and they should not, especially should never be given for the person who has sepsis. It's going to backfire.
Yeah. And even patients with like active TB can become very difficult.
So these are some of the things that need to be kept in mind. Okay. Now I have some questions for Dr. Vinod. Okay. Now you've been seeing COVID patients, so many, for the past more than a year's time. What are the atypical ways that the patient can present to you?
Yeah, see, other than the mild symptoms which you told, fever, body pain, cough, I think most of them are aware of the cough and the respiratory symptoms, but they can have a whole lot of other symptoms getting involved, which includes the brain. They can have altered sensorium, they can be confused. Some of them can be like, they just become dazed, what we call as a clouding. So all those are many symptoms which are have been reported for COVID involving the brain. They can even have a lot of common ones are the gastrointestinal system.
They can present with
They can have
diarrhea.
a lot of episodes of diarrhea, even like
Yes.
10, 15 episodes per day for a few days.
So during this season, if you have diarrhea, probably it could be because of the COVID infection.
Yeah.
You can screen for the COVID test.
Yeah, those are ones.
And then people come with severe fatigue. They don't have any fever, they don't have any breathing difficulty, only fatigue, loss of appetite.
I think most of them have like that exhaustion which they feel, and it goes for a few weeks to a month. And the other important one is what we told about the loss of smell and the loss of taste.
Yes.
So though they may not have fever, they may not have any other symptom, they just have the loss of smell and taste. Sometimes we say it's equivalent to go and test for COVID.
Yes. Okay. So these are some of the ways how people can present, atypically, not having classical fever, classical cough, and classical, throat pain, and then all those things. Okay. Now, there were some people, they have symptoms like fever, body pains, and classical symptoms of cough and throat pain, all those things. But if you do the COVID test, it is coming negative. How do we take this one?
I think in this pandemic situation, there are other viruses also, but then we've noticed that the COVID cases have gone up really. It's just shot up within a few days. So anyone who presents with these symptoms are taken as COVID-like illness, even if the RT-PCR comes negative.
Even the RT-PCR sensitivity is only maybe 70%, 60 to 70%.
So even if the rapid is negative, the RT-PCR is negative, we may even tell them to repeat it after like 72 hours.
Yeah. It also depends how the swab is collected.
Yeah.
It also depends if there is a variant kind of a thing.
Yeah.
So there are so many permutations and combinations why your test can be negative, but still you can be having the COVID-like illness, classical COVID. Okay. So you should not be taken back. It's a clinical decision. Let the physician decide whether it's a COVID or not a COVID. When you do a CT, you might be having classical features of the COVID pneumonia. Okay. Now, this has been a general practice. People, the day one of fever, the classical thing that they do, they panic, they do all the blood tests, whatever is available, and they also even go and do the CT of the chest. Is it really required? When do you recommend, for a person to go for the CT scan?
Even if they come as COVID positive, they are mild illness. I think doing the CT on day one is not. It doesn't give any additional information. It just tells that there may be some infiltration.
It may give a false sense of security most often.
Yeah.
In the first week, the lung involvement will not be there. So it will be typically normal, but that is not the time you're supposed to do the CT scan of the chest.
Because when it's needed, it needs to be repeated. Patients kind of suspect us telling like, why are you doing it again? It's fine. So I would recommend a CT when there is any change in the symptoms, like there's more breathlessness, the cough increases, the oxygen saturation goes down, and the heart rate becomes more. That time we are worried about something called as pulmonary embolism, where there can be clots in the pulmonary artery.
Maybe in the HRCT, you'll be also able to see
Yeah,
viral pneumonia,
And plus,
involvement of the
with
lungs.
there's involvement of the lungs, so we have a better idea of what's happening in the lungs when we do a little down the.
So it is preferable generally towards the end of the first week.
Probably, yeah.
Probably, not definitely not on day 1 or day 2.
Yeah.
Okay, good. Okay. So when do you suggest, that the patient should seek help of a medical personnel or come to the hospital?
I think any
If
of
the person is on home quarantine, when do you suggest?
the same things, the respiratory symptoms increasing.
So if the breathing pattern is more intense, more than 24,
24, they actually feel breathless. They
Breathless.
are lacking breath. They even at rest, see, sometimes they feel breathless when they walk certain distance, but this breathlessness starts increasing even when they are at rest, and the oxygen starts reducing.
when the saturation is coming down,
There's another easy one is like what we call as a 6-minute walk test, where they walk, they check their own oxygen saturation, and if there's a significant drop in saturation more than 2%, and if they're still breathless, I think that's the time when they'll need to come.
so this test is called as a 6-minute walk
Walk
test.
test.
You walk for 6 minutes
Yeah.
and check the saturation
again.
and look at the symptoms.
Yeah.
Yes.
So I think it helps at least when they are progressing towards moderate. I think it's a very good clinical tool to help.
And this test can be done at home.
Yeah.
You walk for 6 minutes and check the saturation before and
again.
after.
Yeah.
Good. Okay. Yeah. I think, probably we will stop here. Okay. And that's what we have to say. Now, over to you, Paul Kiran, and anyone, over to you, Paul Kiran.
Yeah, thank you so much, Anna. Thank you, Dr. Vinod, Dr. Spurgeon. We will have the Q&A right now. Debbie will share a few questions. Actually, whatever we have collected, we have kept it as a PowerPoint. Most few questions are already addressed, and there are a few questions in the chat window. We request all the participants, if you have any questions, to please put it in the chat window so that we will collectively put those questions to our experts here. Debbie, can you please start sharing your screen?
Are you able to view my screen?
Yes.
Yeah.
Okay.
Yes.
Maybe you can go for the presentation mode.
Just a second. So Anna, basically we've categorized them into general and prevention, then regard to vaccination, hospitalization, etc., and some miscellaneous questions as well.
Sure.
Okay, so for the benefit of everyone, shall I read it one by one?
Yeah, that should be fine, Debbie.
Okay. So given the spread of COVID, it is apparent that there are a lot of asymptomatic patients in India who would be super spreaders. There is no plan to address this section. How can we take any steps to behave responsibly to ensure we are not in this category?
I think the first and the foremost, these are the people who are the close contacts. For example, if one person in the family is positive, there is high chance for the family members, they might be, having the infection. Especially the children are some of the people, and the young people, they will not feel any symptoms, but they are the people who can spread the infection because they are asymptomatic. The best thing to do is that isolate and quarantine if you know that you are positive. But if you are the primary contact, and if one of your family member is positive, the best thing that we can do is that probably you should isolate yourself for a week's time.
Yeah.
And after 1 week, you can do a testing, okay? And if you are negative, then you can mix with the general public.
Yeah.
So quarantining, isolation, and then checking, if you are the primary contact, not mixing with the people till, you isolate yourself and then test yourself negative. I think these are some of the things that you need to do so that you will prevent the spread of the infection to the other people in the community and also in the house. How about the mask and the hand hygiene? What suggestions you will give?
Even at home, they are expected to wear masks, whether they're positive or their contacts. At least 24 hours they'll need to wear. Even a surgical mask is fine, but if the patient is a COVID positive patient, if they have a facility for N95, they can wear it 24 hours of the day. And they will have to be isolated in a separate room and all their vessels, their clothes, everything should be separately kept for them.
So that person has to be separately isolated,
yeah.
okay, and that person has to use a mask, okay, and avoid crowding. For example, if you go to the streets of Bangalore, probably it must be the same thing even in other cities also. Because of the lockdown, it is like this, but otherwise it was just like any other day. And even when you are wearing the mask, we are wearing it below the nose. Ideally, it has to be above the nose, and it has to fit properly.
Yeah.
I think probably these are some of the precautions that we can, take and ensure, so that we will be the responsible citizens of our country.
Yeah, many of them say they feel uncomfortable wearing the mask, so they remove even patients who have COVID positive. But I think it's a way of life. I think for now, for their sake and for the sake of the society, I think everyone will have to wear a mask.
I suppose that may become the norm. We do not know. Yes. Yes, baby, you can go ahead.
Sure, Anna. So what is the reason for the same virus to make one person asymptomatic, whereas the very next person is symptomatic?
I think it depends upon the age of the patient. Generally, younger people and the children, they're not much affected like how the adult people are affected. That's number one. And the immune status.
Yeah, they are also varied, but we are seeing younger population also getting affected. So I think,
but it is not as common as the older population. And it also depends upon the comorbid conditions, like if you have diabetes, that is an immunosuppressive condition. That means people who have diabetes have less immunity when compared to the normal people. So age, the immunity, having the comorbid conditions like the kidney problem, heart disease, liver problem, diabetes, hypertension. So it all depends upon all these things, and also it also depends upon the amount of exposure to the virus. If the viral load is more, then the chances for you to have a severe infection is more. So it depends upon the various factors.
Thanks, Anna. The next one is certain studies suggest that the coronavirus is now being identified as an airborne virus. That means it can transmit after being present in the air for some time. Is it true? The presence of very fine droplets in the air is termed as airborne. Is that true?
As per the WHO, okay, it is predominantly transmitted by the large respiratory droplets. Okay, at the surfaces they get contaminated with. This is what WHO says. Okay, airborne is much less common. It doesn't say it is not possible. It is possible, but the chances or the probability of the airborne is very, very less. For the people who are working in an ICU setting kind of a thing, where they use the nebulization, the aerosols, and the ventilation, there the possibility of the airborne transmission is very high, and therefore they need to have all this masks and the goggles and all those things. For the person who is outside of the ICU kind of a setting, where the aerosol generation is not there, the probability of airborne transmission is very, very less. But having said that, it is less common, but it is not impossible.
And even when a person sneezes, the spray can go even up to 6 feet.
Yes.
It's quite a long distance, and then it gets, the droplets can settle. So still it can spread to a wider area.
It can spread, but it is less common. Yeah.
Thank you, Anna. So do we have to keep sanitizing every product we buy from the shop and things like that?
I think if you look at the surfaces, I think it depends upon what kind of a surface. For example, plastic has around 2 days.
See, these are viruses, and they need to survive on a living thing. So the survival is very less on the fomites transmission and all. They found the incidence is very low. It's more of person to person, close contacts, direct exposure with the patient. I think they have more transmission rather than fomites, meaning like on the desk or the table, the door handles. There are other viruses which can also transmit. COVID, they feel the incidence may be lesser.
Okay, thank you.
But I think people are worried.
I think I've skipped a page. Yeah. So is there a minimum time of exposure with an affected person to be designated a primary contact? to suspect the possibility of the person being affected?
I think the direct contact, it should be
15 minutes.
less than 1 meter and for at least minimum of 15 minutes.
Yeah.
This is the definition of a primary contactor, So 1 meter distance and 15 minutes. This is, what you say with the infected person, even when the person doesn't have symptoms, maybe mildly symptomatic, but still you call them as,
Yeah, even before the onset of symptoms, by 3 days, even before that, they can
Yeah.
still be infected.
So even before they are symptomatic, they can be still infective. So
Okay.
if they stay with that person for 15 minutes, less than 1 meter, you will be a primary contact.
Okay. So even when people are coming for door delivery and things like that, it's better to leave the package and step away. Would you agree, Anna?
I think it's more a social distancing.
Yeah, but even if you, take those things, you'll not be staying with them for,
Yeah.
hardly maybe 1 or 2 minutes. You'll not be
Yeah.
with them for 15 minutes. So
Yeah.
the duration is very, very minimal and less.
Okay. Okay.
I think it's better you wear a mask when you come in contact with them.
Of course, yeah. Better to take the precaution of wearing a mask.
Sure. So is double masking effective? Is there are there risks of oxygen deprivation or inhalation of carbon dioxide which we breathe out?
Double masking, I think even a single a face mask or even a cloth mask is better than not wearing any mask at all. Double masking we generally use in the hospital because we're actually coming in contact with the patients. Because after we see the patients, we change the mask. So the outside mask we throw it, we go to the next ward. So it helps in that way. But for the general public, even a single mask should be enough. So it's not necessary that everyone should wear a double mask. And regarding the oxygen deprivation, I think when you wear N95, there is a complete seal which happens. So in the micro environment where you're breathing, the carbon dioxide saturation can be very minimally elevated. So you may feel a little bit breathless, but it doesn't affect the overall oxygenation on the long run. So I think you shouldn't worry about that.
You might feel uncomfortable, but it's not going to affect you. For the people who work with the COVID patients, and predominantly where there is aerosol generation, you have to use an N95 mask. But in other hospital settings, a regular surgical mask, single surgical mask should be sufficient. Yes.
It's more about covering the nose and the mouth.
Yeah, and it has to be snugly fit to your nose. That is very important.
Sure. Will asymptomatic patients heal on their own without any intervention?
Of course, definitely, they will not require anything. They'll just recover.
Thank you.
Vinod says they are the blessed group.
Yeah. So is the virus, if the virus remains does the virus remain in the air for 3 hours? If so, will the entire city get infected even if at home? So I think this is a repetition. I think you've answered.
A repetition of the previous thing that was answered, I suppose. Yeah.
So why some people are affected with COVID are going into serious state and some are dead? Okay. Again, I think you have answered this because you've spoken about
the
age
negative prognostic factors: age, elderly people. Number 2, obesity.
Yeah.
If you're obese, or if you have the comorbid conditions like the diabetes, chronic kidney disease, or the lung disease, in this group of people, the outcome is not good when compared to the other people. So, if you have even a moderate disease with these comorbid conditions, it is preferable to be in a hospital setting rather than, and if the bed is available, rather than staying at home. Okay. So obesity, elderly, diabetes, lung disease, and the kidney disease. Heart disease.
Yeah.
Even heart disease.
Thank you. So if you come in contact with a COVID-19 positive person, how long should you wait before you can get yourself tested if you are?
I think, 1 week's time, you can isolate yourself. If you are the primary contact, okay. If you get in contact with a COVID positive patient, and after 1 week, it's better you go
by the 5th or the 7th day.
If you're within 5th to 7th day, you can check it. And if you're asymptomatic and if the sample is negative, probably, it can be, issued.
But within the initial first week, if they develop the symptoms, I think they should wait for testing.
Yeah.
Yeah.
If you are symptomatic within the first week, it is better you test.
Sure. Okay. So children are doing better, is what we hear. Do they require any supplements to develop immunity?
Generally, the disease, with the children is, not very, symptomatic and not very severe. Okay. But I think in the second wave, my wife is a pediatrician. She's telling during the second wave, during the current wave, even the children, they were seeing affected with COVID, which was not the case, what happened with the first wave. But generally, they're asymptomatic and they have the milder disease. Even if they have fever, generally they recover quite fast. There's nothing wrong to give the supplements, multivitamins. I would like to mention about the vitamin D, So there was so much of hype that vitamin D will cure, vitamin D will boost your immunity, all sort of things, But the hype that was projected in the media, that may not be the real case, Maybe some help, but it's not going to, drastically change the outcome and the scenario of the COVID infection.
And regarding the diet, I think for everyone, including children and elderly or adults, I think they should have a healthy, balanced diet, I think, which is the most important for any disease for that matter.
Yeah.
Okay. You are right, Anna. The B3 question, there's a whole section. I think we are coming there, reaching there soon. Yeah.
So in case if you're taking the vitamin D, you should not overdose yourself.
Yeah.
The daily requirement is between 1,000 to 2,000 international units. Okay. And for the person, say, suppose if you're deficient, maybe you can start with 2,000 units every single day. Generally, what we do in case of vitamin D deficiency is that, we start with 60,000 units once a week, maybe for 6 weeks, So during this season, if you are deficient and if you want to boost up your immunity, so-called, we do not know how much it will boost. You can start taking 60,000 units once a week for maybe 4 to 6 weeks, and later on you can take 60,000 units once a month, and that should be more than sufficient.
Okay. So it has no direct, you cannot call that a cure, right? For
definitely no. Definitely no.
People are, yeah. So there is recommendation that you take 60,000 IU several times each day. Is there anything negative that can happen?
No. In fact, it is dangerous to take. You'll have vitamin D toxicity. We have high calcium levels. That's not recommended. If you're taking 60,000, you take once a week, maybe for 4 to 6 weeks, and then you take monthly once. That should be more than sufficient. If you want to take every day, maybe 1,000 to 2,000 international units per day should be sufficient.
One more thing is, I think many of the patients take vitamin supplements on their own for many years. I think many of these vitamin supplements also have a very small dose of vitamin D. So I think they shouldn't overdo, like what Dr. Spurgeon was telling. They'll go into vitamin D toxicity. So they should know if they are taking vitamin D in any of their regular supplements.
Okay. Yeah, because that was something that was doing the rounds in all our groups. So thank you for that clarification. I'll move on to the other question. If tested positive, what are the basic medicines? I think you've covered that, so I think we can skip that. Is there any diet that should be avoided if someone's tested positive?
I think it's basically whatever the food that will be easily digested can be taken. Once you have the infection, for the people who have diabetes, they should be mindful about the sugars. Infection can shoot up their sugars, and it also depends upon the diet that they take. So be careful and monitor your sugars in case if you have diabetes, and be mindful of the diet that you take.
Yeah, some of them, especially, they're using home remedies. I think it should be okay to do, but they shouldn't overdo it. Some of them take 3-4 times per day.
Turmeric, ginger, clove, all those things we do not know. You can take. There's no harm. There's no need to overdo those things. Yeah.
So this is also something like steam inhalation also is touted to be you can completely prevent COVID if you are doing steam inhalations every other hour, alternate hour. People are even carrying it if they are traveling and they are constantly, subjecting themselves to steam inhalation. What is your comment on that?
I think it's more of a panic mode. I mean, the steam is 100 degrees and above, which is that's why the water becomes steam. And there are things like the virus will die at 40 or 50 degrees Celsius.
Yeah.
But thing is, they'll burn the nose and the entire airways.
See, the virus is inside the blood.
It already infiltrates.
It's already inside the bloodstream. So it's going to give only symptomatic relief. It's not going to kill the virus.
Doing it, I mean, if they're doing it like once a day, twice a day, it's fine, but they should take precaution that it's at a distance and then they take a steam. Sometimes they can get burns because of the steam.
There is no need to overdo this one.
Yeah.
It may give symptomatic relief maybe twice a day or something like that. That should be sufficient. It is not going to definitely kill the virus.
One thing is because the virus infiltrates the cells and it goes inside. So even if the steam gets in contact, you're going to touch only the layer. You're not going to penetrate inside.
And by the time you are symptomatic, it is already in the blood.
Inside the steam, yeah.
Okay. Thank you. That's clarifying, I think, a lot of questions. I saw this even in the chat box. So
And one more thing additional, they say drink hot water, it flushes into the gut and makes the hydrochloric acid kill the virus. I think they're more of hypothetical.
Okay. So yeah, this is with regard to home treatment. How can one check his or her O2 levels or condition of lungs if they have no oximeter?
I think, probably they might be talking about some of the apps which can detect the, pulse in oxygen saturation, but we do not know how accurate they are. We should not be misguided, by those things. The best thing is to be, to have a pulse oximeter and be guided by that one. Because sometimes, especially when you have the low oxygen levels, some people may not have any symptoms at all. You call it as a happy hypoxic state. They feel better, they feel elated, but it's all because of the hypoxia. So don't be misguided and be misled by the other things which are not validated. Okay. So I would suggest better to use the pulse oximeter, and also not just based on the pulse oximeter, you should also look at the other symptoms that you have, increased respiratory rate, fatigue and the tiredness, breathlessness, all the things need to be taken into consideration, if you have to make a decision to go and see a physician or for a hospitalization.
Sure. So the next question is, will panic lead to reduced immunity and contribute to the progression of the disease?
I think panic and anxiety can cause a whole lot of symptoms and it can worsen, I think, everything else.
The body can switch into a different mode, okay, in a panic mode. May be possible, but how much, and how much percentage we cannot really tell.
Yeah, I mean, definitely it's not good to have.
It's not good to be panicked. I mean, yeah. I think we should trust God more than panicking during this time.
Once you're panicking, many patients are anxious, they're worried. I understand. But thing is, they may not do their breathing exercise regularly. They may not eat their food regularly. They develop gastritis. A whole lot of symptoms will definitely worsen if they're anxious and panicking.
And sometimes what happens is because of the anxiety, they'll breathe more. And they think that is breathlessness. It's not because of the breathlessness, it's because of the panic thing. They'll be hyperventilating, breathing more.
Yes. So this question 6, you have already answered, but I'll just read it out again. Does treating the patient too early with steroids weaken the immune system of the patient, leading to progression of the disease?
Yes, it's a very important thing. It needs to be kept in mind. We should not abuse the steroids. It's going to cause counter effect.
Only one I want to add: if the patient is already on steroids for some other underlying conditions like arthritis or any other medical conditions, I think during this, it's called a stressful situation for the body. They may need steroids at the time of fever during the initial courses of the disease itself. So as I told you, it again depends on what the underlying comorbid conditions. But in general, for a normal person, just day on, day or two of fever with normal oxygen, I think steroids may not be indicated.
Okay. Also, when it comes to like extending, taking steroids beyond 5 days, does it need to be tapered?
It depends upon the clinical condition. We generally give between 5 to 10 days, depending upon the progression, depending upon the response to the steroids, So it's a medical decision, It's better not to do it ourselves. It should be done under the supervision of a doctor.
Sure. Thank you. Antibiotics is for bacterial infection. Why do doctors include antibiotics in the treatment?
I think the day one of illness, there is definitely no role because it's a viral infection. The only possibility is that if there is any secondary infection, it might help. That's the only thing. Otherwise, it's not really indicated as such.
Yeah, as I told, there are patients who come with secondary infections. See, like they can come with stroke, with breathlessness. So there's a high chance that they can have an aspiration pneumonia, which is bacterial infection with COVID. So this patient may benefit from antibiotics being started on day one. They can have urinary infection. So it again depends on the condition, but everyone starting on day one, antibiotic may not be helpful.
Yeah, provided it is day one. Sometimes you do not know when you started having symptoms. Okay. So that's also there, It could start with mild myalgia, mild tired or fatigueness. You may not recognize that one. Yeah. But generally, with COVID, because the patients who require steroids, they're the sicker kind, and they're the ones who are elderly, having multiple conditions like the diabetes and other things. There is every possibility for these people to develop a secondary infection. Okay. So that's a reason, they start the antibiotics because the patient is immunosuppressed and the patient has diabetes, patient is sick, and there is a possibility of having a hospital acquired infection. So those group of people definitely they have to be on antibiotics.
Sure, thank you. So with regard to hospitalization, yes, you have covered it, but we'll still go over these questions. What are the indicators to rush to a hospital? Is it only oxygen saturation levels below 92?
I think oxygen saturation is just one marker. The breathlessness, cough, severe cough, even they can have blood and sputum. They can have other symptoms of COVID. They can have brain symptoms. They can have cardiac symptoms. So it depends on what symptoms they are. Any worsening symptoms, including like breathlessness, chest pain, like a weakness of any particular side of the body, I think they will have to come. So I think they shouldn't wait only for the oxygen to go down. If any of the symptom worsens, I think they need to take at least physician's opinion that time.
Yeah, because COVID also can cause blood clots. It can cause, blood clot in the lungs. We call it the pulmonary embolism. It can cause blood clot, to the vessels that are supplying to the brain, causing the stroke or the heart attack. So apart from the saturation, is predominantly the involvement of the lung, increased respiratory rate more than 20, feeling of breathlessness. They can even have the cardiac symptoms. They can even have the stroke. They can even have the heart attack. There are many manifestations. Yeah.
Okay.
But the most common thing is the oxygen saturation. The other things are not very common.
Sure. Okay. So is it possible to have oxygen levels below 90, but the patient does not have breathing difficulties?
I think I have already told about the happy hypoxia.
Yeah.
So they'll be very happy, comfortable, and they will die in sleep without even complaining, So some other patients, they can develop, symptoms like that. The oxygen saturation is low, but they will not have any symptoms. So that's the reason we need to monitor the oxygen levels at home, at least 3 to 4 times in a day.
At least I think they should keep even for like at least 30 seconds to 1 minute, because it takes averages of many readings and then you get a value. So the moment you put it, don't start reading the pulse oximeter, because if you use it on someone else and then you use it on yourself, the levels will change. And if your hands are cold, I think warm your hands.
You just need to wipe your fingers and warm.
And no nail polish also, it will also affect it.
Okay. So you said we can monitor it like 3 to 4 times a day. But what if there is a sudden drop in a patient who's under home treatment?
I mean, if the person is having the saturation, borderline saturation levels, I think it is preferable to check more frequently, maybe every half an hour or hour. It all depends upon the severity of the symptoms.
I think if they feel symptomatic, they should start planning on where and when to get the opinions.
Yeah.
Bit on that.
Okay. So, and in case there are no beds available at that point in time, then what are the other things that they can do?
Okay, I think for the person who is having the moderate, maybe heading towards severe, or else the person who is symptomatic with low oxygen saturation, or else increased breathing, or else, pulse is going up, in such group of people, if there is no oxygen blood, before that one, I would suggest, they should do the awake prone, exercises.
Okay.
They should start doing the incentive spirometry. The third thing is they can even do the nebulization at home, maybe with the body cot and the dual.
Inhaler may be better.
Maybe the inhaler also is fine, in the spirometrol or the dual inhaler, and then probably these are the group of people definitely require steroids.
Yeah.
It's better you start off the steroids, dexamethasone 6 mg, if possible injection or as an oral tablet.
And I think that
You should not wait for the hospital bed.
Yeah.
You should not wait. In such group of people, you have to start off the
At
steroids.
least you can start, but then we'll have to have.
Yeah. Meanwhile, you start off these things and start searching for the beds.
Okay. So it's good to also keep a stock of these things, especially like when it's on the borderline itself, I think.
Yeah, we do not know, when they will progress, and then, yeah.
Mhm. Can you tell us a little bit about the use of oxygen concentrators and how effective they are, and up to what point can we rely on them?
Yeah, they are available online. You can buy
You
them.
can have rental also.
The rental things also are available, but currently they may not be there. I think there are some companies, the cost is maybe 60,000 to 1 lakh kind of a thing. Oxygen concentrators. If they do give oxygen, probably at the most maybe 3 to 5 liters per minute.
7, yeah. They are different.
But it is better having than nothing. So if you can afford, if you want to keep it, I think this is a good thing. It gives some amount of oxygen, at least 3 to 5 liters.
5 liters. There, I think high end can go up even 7 to 10 liters.
Yeah, the maximum you can go up to 7 liters.
The thing is about the oxygen concept, you will need continuous electricity and power.
Yeah.
So sometimes if the power is an issue, I think the cylinders will have to be like a standby.
Yeah. But it is good to have it rather than not having anything, not giving oxygen because of the non-availability of the hospital bed.
Sure. Okay. So what line of treatment will improve the oxygen levels apart from, I think you have already answered that, so I'll skip that question.
Yeah.
Procedure to follow for hospitalization if one is seriously ill, what would that be? Is going through the BBMP helplines the best option given the scarcity of beds?
I think, if you have to go through the BBMP, as I was told, it generally takes around 3 to 4 hours, 2 to 3 people continuously calling, and that's how you'll be able to get a bed. But as of now, the ground reality is that there are no ventilator beds. I think in Baptist Hospital for the past 1 month, we don't have. The sad situation, we are not able to enhance, but it is a reality. I think we have come to a situation, even if there is no ventilator bed, if they have oxygen, probably we should undertake the risk. The basic problem is that, for example, if I take a person who is having saturation of maybe 80 or 85, there is a possibility this person may improve with the medication, steroids, and the normal oxygen. But there is also a possibility this person can worsen and require a higher support like the ventilation and all these things. Ventilators availability is out of question. Probably you have to take a risk if the hospital tells, see, we don't have ventilators. What we can do is that we'll be able to start the medication. We'll be able to give oxygen. If that is okay, if the patient worsens, we'll not be able to escalate. We have to look for a ventilator in some other hospital. If that risk is taken, probably hospitals will be willing to take that patient. Probably you have to go for that because there is no other option left. Yeah, we are in such a situation like that.
Patients sometimes will wait for like 48 hours to get an oxygen bed. But somehow with the initial set of medications, awake proning, I would still say awake proning exercises made a lot of difference in these patients' lives. So maybe in the next couple of days also, if they get the oxygen sometime down the line, it's still helpful.
So awake proning, incentive spirometry, steroids, all these things need to be started, while you are still waiting for these things.
Okay, thank you.
Even if it is an oxygen bed, and if they cannot guarantee a ventilator, still I think you better go ahead and then let them, get admitted wherever it is, later on you can think of ventilator or the other escalation if it is possible.
Okay. Sure.
because we are expecting the peak to last till May 3rd week, it's almost still, a month, 1 month.
Yes,
We do not know
yes.
how we are going to manage. We need the grace of God. Yeah.
Yes, definitely. So with regard to vaccination, is it true that if you are vaccinated with both doses, the effect of the virus is going to be mild if you happen to get affected?
I
think
think I
I've covered
presented the
that.
data.
One more thing I want to say is like many of them ask like why did they get the COVID infection in spite of being vaccinated? It's not going to give 100% protection for that person, but I think it definitely reduces the severity of the illness. So I think whoever gets the opportunity to take the vaccine should take the vaccines.
Yeah, some people after taking the vaccine, they'll be having fever for 5 days, 6 days, and 7 days. It is not because of the vaccine, and probably it is because of the COVID thing. So it is better, fever because of the vaccine may last for a day or two. That's it. It will not be prolonged fever. In case if you have prolonged fever, I think probably you need to get tested for the COVID. It is not because of the vaccine.
They may have local symptoms like pain or like mild swelling, but I think that should subside within a couple of days, not more than that.
Yeah.
Getting natural immunity better than taking vaccines. I think that's a good question, but the only problem is you don't know if they will progress to severe and they will die, or they will develop severe morbidity because of the illness, and we do not know who will worsen. So
You'll not be able to get the natural immunity overnight.
Yeah. So, I mean, the natural immunity, obviously, the antibody levels may be much higher than what you take from a vaccine. We still have studies coming up. But thing is, as it's natural, you don't know how the disease course will be.
Yeah.
I mean,
because we have young patients who are who don't take the vaccine, who don't wear masks. So like I exercise, I'm extremely healthy, I have a healthy lifestyle. But unfortunately, once they have issues in the lungs, they are very miserable. I think it's not worth taking the risk for now.
Yes.
Sure. So this is also a question that's come up even in our chat, asking what's the best time frame between the two doses.
I think for the COVID shield,
should it be 2 months? Should it be 3 months? What is the best time gap between the first and the second dose?
So initially, when we took the vaccine, they gave the vaccine for the frontline workers. It was 4 weeks apart. Okay, but the studies showed that the best time is after 8 weeks.
Yeah, minimum of 3 to even 4 months. They told.
Yeah.
But I think
so the response is better for the people who have taken leave. But now the government guideline is after 6 weeks. Between 6 to 8, 6 to 8 weeks window. Yeah.
Okay. And what is the difference? What is more effective? Is it Covaxin or COVID Shield? And I don't think we have a choice anyway, when we register.
I think COVID Shield is a different spike protein based vaccine. But Covaxin is a whole inactivated. See, we can only give numbers like 70%, 80%, but end of the day, it's better they take whichever vaccine is available for them, because the Pfizer and the Moderna vaccines are not yet available. And plus, in a country like India, transportation of the vaccines is going to be extremely difficult. They need to be kept at minus 70 degrees.
The
Pfizer and the Moderna. These things can be stored even at a 4 degrees temperature. So it's easy for distribution and vaccinating maximum people with Covishield and Covaxin.
Okay. And this has also been circulating. We see a lot of forwards saying women should not take the vaccination during the period, even before or after, a few days of the menstruals, the period. So is there any truth to this?
I think there is no contraindication as such with regards to the cycles.
I think if
they can take that, should not be a problem
they should
at all.
be able to take it.
Okay. Also, before I move on to the next question, also there was a question about, and what about women who are planning pregnancy, women who are under IUI or IVF treatments, or what about them?
There are not many studies with pregnant women, so it's difficult to tell them to take a vaccine, and it should be an individualized choice in taking a vaccine. Because there are not many studies, it's very difficult to do any drug for that matter in a pregnant population. So it should be an informed decision.
This is a new disease, and the vaccines available are new vaccines. So we don't have, sufficient data to validate and then recommend, during this pregnancy or planning for
But I
pregnancy.
think if the married couple, they want to take, I think if they have the opportunity, they
There
can
are
take.
some reports from UK
Yeah.
they have taken during lactation and they felt it was safe. There is no problem.
Breastfeeding should be, I think, okay.
Yeah.
Okay. Since we are hearing cases with blood clots after vaccination, is there any link between vaccination and blood clots? Are people with untreated cholesterol and unknown heart issues vulnerable? Any tests related to this help in preventing such incidents?
I think with regards to the first question, vaccine and blood clots, okay? As I have showed in the slide earlier, the incidence is 1 in 100,000 to 250,000. With regards to the Johnson vaccine, which is a single vaccine, there was a concern in the US, people started developing blood clots and therefore they have, withheld that vaccine.
I think it's against.
Yeah, but it is again started. With regards to the Covaxin and the Covishield, the incidence is very, very less. So it can be safely taken. So there's nothing to worry. Okay. People with untreated cholesterol and unknown heart issues are vulnerable. Any test related to this, help in preventing such incidents. Okay. If the person is having, the heart disease and the high cholesterol, okay, they have to take the statins, cholesterol lowering agents, and they have to be on the antiplatelets like the ecosprin and then the and the clopidogrel. Okay, so those are the standard precautions that need to take, irrespective of the COVID, with COVID or without COVID. But during COVID, we need to monitor the blood test, what you called as a D dimer. Based on the elevation of this one, you suggest
all the inflammatory markers.
All the inflammatory markers. You suggest, blood thinning agents.
Yes, we can give.
Okay. Thank you.
And any test related to help this in preventing such incidents, I think it's very difficult to say, because if they have underlying heart disease or they have family history of heart disease or early heart disease, I think they are prone for developing heart-related issues. But then you cannot say that it's related to the vaccine. It may be because of the underlying uncontrolled diabetes, cholesterol itself causing the clots. They may be smokers. So I think all these, the avoidable risk factors, modifiable risk factors should be addressed too.
Okay. So why are vaccines being administered in 2 doses, and how long will the vaccine immunity last? Is it true that booster doses are required each year?
I think it's just less than a year. I think
probably this may take the course of the flu shot, which we take every year, because what we are seeing even in our hospital, a person who had infection, they had the reinfection. It's not going to be a lifelong immunity. For example, like polio, some of the viral infections, they'll have the lifelong immunity, but this is not like that. In our own hospital, a couple of people, they had reinfection again after a few months duration. So probably we have to take, like the flu shot every year. This may also be the same scenario and the same story.
I think, earlier we were discussing, it takes few years for a vaccine or a drug to be released into the market, because you need to see, analyze, validate the results. This is a new virus, this is a new vaccine. So it's just been a year. So how long the immunity lasts, I think only time will say.
Yes.
For now, it's 2 doses, and it's given like 2 doses because once an immunity is triggered, it's known that once the body is exposed to the particle of the virus, it's not the entire virus, it's not the particle of the virus. It already knows and remembers that it's a foreign agent and it needs to fight against it. When you give the second dose, the immunity becomes even more. That's why it's usually most vaccines are like 2 doses.
Okay. Before we proceed, can I request Mahindana and John Theo to look at the questions in chat and just keep it ready, because we are coming to the end of these questions.
Yes, Debbie.
Yes.
I think we are on top of it.
Okay, thank you. So this question 8 is already covered. Question 9, is it good to postpone vaccination because of the rush in the vaccines and in the centers? Who knows if there are carriers and asymptomatic people there.
Probably you can have a nice mask properly covered and then get the vaccination.
I think maintain your social. Many of them, after taking vaccine, they remove the mask and then they take a photo. So I think again, after taking the vaccine, then they say they develop COVID. Of all you know, they might have been exposed taking photos there out there.
So definitely would recommend vaccination, yeah. But you can have the proper mask and then come in.
I think after, in case it's related to patients who developed COVID, I think minimum of 2 weeks after the symptoms are fine, they can take COVID vaccines if they're post-infection.
Yeah, if they develop the infection after 2 weeks.
After the symptoms, yeah, maybe a month.
Sure. So these are some more questions that came in from chat and I added them here. Is RT-PCR reliable? Is there also any test where we can, which comes within an hour, like of testing, is something like you rely on such short-term tests?
RT-PCR is definitely reliable, okay, but the sensitivity, it is around 70%. That means, there are many other factors like, for example, the way how the swab was collected, okay, and the sensitivity of the RT-PCR is around 70%. And the third possibility, depending upon the mutations, whether this PCR will be able to identify the mutations. And then, so these are some of the things, but generally RT-PCR is reliable.
It's reliable, but one thing I want to add, because many patients come as rapid positive, because rapid is what you were telling, within an hour you get.
That is a rapid antigen.
Rapid antigen. Now say rapid antigen is positive and the RT-PCR is negative. It does not mean that they do not have COVID. The RT-PCR has come negative. What we call it as a false negativity. So if they're suspecting COVID, I think they'll have to proceed and treat the patient like a COVID patient and how they manage them. But you cannot say RT-PCR is negative, so they do not have COVID. So even if an antigen is positive, you're supposed to consider patient as positive.
Yeah.
If clinical suspicion is there, even they can repeat an RT-PCR again after 48 to 72 hours also.
Yeah. And then quick reporting less than an hour. Antigen gives quick reporting, less than an hour. Currently, we have one more PCR test called the INAT. It will give less than 1 hour, but we are not rolling it out for the public. We are generally using it only for the patients who present to the emergency, without the COVID testing, so that you'll be able to decide where the patient has to go and which location the patient has to go. But they are available, the INAT PCR test, which can be given within 1 hour's time.
Okay.
I just wanted to add an example. When a patient comes for HIV testing, normally they do 3 kits. The very reason it's done, because it's very difficult for us to do rounds and see patients, because there are a lot of fights also happens because they say that you unnecessarily kept the patient in a COVID ward, but the RT-PCR is negative. I just want to tell that there's something called as false negativity. So the very reason HIV tests are done as 3 is because even if one comes as positive and other comes negative, they will again repeat the test to just confirm if it's negative only, because it can be false positive, false negative. So it all depends on the clinical situation and they'll have to do the test accordingly.
Yeah, I think in this scenario, when we have the fever, because the treating the COVID infection is totally different. It's not the antibiotic.
Yeah.
With the respiratory problem, it is not the bacterial infection. They do require steroids. Okay, so it's better you leave the clinical decision to the treating physician.
So
if you don't consider this as a COVID thing and start antibiotics, the patients will deteriorate and then they'll become more sick.
I think people should accept and they should be willing to accept the diagnosis of COVID, even if the test comes negative and if the physician tells.
If the clinical picture and the CT and all the things are suggestive of a COVID picture.
Okay. So I think the remaining questions you have answered. What about question 4? It says, could you suggest your recommendations for CABG patients?
I think it depends on if they're post coronary artery bypass and say the carotid Doppler has picked up block. Every block not necessarily is significant. They can have blocks happening over age, depending on underlying comorbidity like diabetes, cholesterol, etc. Even hypertension. They can progress over time. But now, if they are symptomatic, like when they have weakness of the part of a body, what we call as a TIA, transient ischemic attack. The very recent patient has undergone a coronary artery bypass. It means they have issue to the heart, and anything which affects the heart, they can have similar changes in the brain also. So if they have any symptoms for the brain, like weakness or difficulty in speaking, slurring of speech, difficulty in swallowing, they can have transiently, can happen even within a day, within 24 hours, they may become normal. Now, these patients will have to be picked up, and you need to see if anything like stenting will have to be required for the carotid artery a blockage. But every block, I think, is not significant. But if it's more than 70 or 80%, or even less than that, but if they're symptomatic, it will be considered significant. And whatever medications they're giving for the heart also will help for this. But again, it depends.
Basically, your aspirin, your cholesterol medication, they need to be, taken definitely. Yeah.
Okay. Okay. I think we've come to the end of the questions that we received earlier. Now, I think Paul Kiran will ask the questions that have come in through chat.
Yeah, sure.
Or Mahinana, do you have
yeah.
any other extra questions? Thank you so much, both Dr. Spurgeon and Dr. Vinod, for patiently answering all the questions and giving us this clarity.
Thank you.
Mahinana, I want to go. Do you have any questions? Yeah.
Yeah, I had made a few note of few questions that came in the chat box. But yeah, personally, I feel that there's a very exhaustive session, having covered a whole deal of questions. Still, there are some in the chat. One person is asking that there is a throat itchiness and cough for a week. Should I suspect COVID? And another person is asking that there is phlegm and no fever. Can it be indicative of COVID?
I think definitely it is better to screen for COVID.
I think also when they have associated change in smell, I think it automatically points to it. I think people should be willing to get it tested, and they should take care of themselves also.
I mean, because now it is a pandemic and it is a second wave. The first differential diagnosis will be COVID only. Yeah. It is possible they may not have COVID and have a normal cold also, but it is better we get tested.
I just want to add another two more things in related to COVID. I think one of them I've asked about if there's only one bathroom and there are 3 members at home, what to do. I think after the person infected with COVID uses the bathroom, they can clean it using the disinfectants which are available at home, and then flush it, and then the next person can use it. They can have an exhaust fan also, so that it clears the air. But that's the only option for now. They can clean the area also.
And the COVID positive person who uses the bathroom can use the mask. That is better.
The one more thing I want to say is about patients who develop a lack of smell, a lack of taste. It's going to take some time for them to recover. One easy thing is called as smell retraining, where you choose 4 items like cinnamon, coffee powder, lavender oil, just common ones you use at home, at least 4, and keep smelling it every day, twice a day, at least for a month or 2. You're just trying to help your brain recover your smelling sense. So smell retraining may be helpful for people who have anosmia or lack of smell.
Yes. And some questions on the vaccine front. Some of them might have been answered, but one person is asking, what would be the effect of vaccine on people with underlying health conditions, particularly heart conditions, diabetic, or asthma?
I think it is important for this group of people to take the vaccination, because these are the highly vulnerable and highly, if they have the COVID, the outcome is not good when compared to the normal people. I think these are the risky group. I think is definitely indicated for these people.
So
I think the underlying allergies, I mean, if they're having allergies to multiple drugs, I think they will have to, it should again be an informed decision, because see, we do not have all the answers at hand. And if they are already allergic to many things, even if they develop a small pain, they'll start panicking and worried that it's an allergy related. So I think if the patient has underlying allergies, they will have to discuss with their respective physician who's taking care of them, and then take an informed decision.
Okay, informed decision. Same thing goes for a person with varicose vein also.
I think it's not related to.
Varicose veins is nothing to worry, So there is no, it's not a contraindication at all. They can, happily take the vaccination. That's not a problem at all.
Even patients who are, I think one common question is a patient on blood thinners, whether they can take the vaccine. I think they should take the vaccine.
Yes, yeah.
Even if they're taking ecosprin or clopidogrel, they can take. Only precaution, don't rub the site of vaccine. Just leave it aside. So that should be fine.
Another question is, after a COVID infection, how long should I wait before I take a vaccination? Two parts. So one is how long can I wait, and the other one is how long should I wait?
After 2 weeks is the recommendation. But if they have the severe infection and have taken the plasma therapy, I think it is more than
6 months.
couple of months.
Because the immune response may not be adequate after it.
Yeah.
Because plasma therapy is very.
Or if it is a mild to moderate infection kind of a thing, after 2 weeks after the after the symptoms clear, you should be fit enough to take the vaccination.
Okay, so if they take before that, there can be a harmful effect also. A person who has taken plasma therapy.
It may not be effective because plasma therapy is basically you're taking the blood from an infected individual and you hope that antibodies will try to clear the virus. So you already have antibodies against the virus. So it may not be useful. It may not mount a response that much.
Yeah. But you will have some, for a normal person who has got an infection, you will have some protection antibodies created for.
Yeah. At least for a month or two, you will.
I mean, yeah, the protection will be definitely there. How long the protection will be there, we do not know.
See, there are patients who come with reinfections. Even I've seen today patients with reinfection. The patient had few months back and again she's come with similar symptom and again got readmitted. So definitely there are reinfections happening. So you will still, even though you got COVID once, there is chances that you can again have COVID again. Yeah. So mask again.
Yeah. Thank you very much, doctors. Please? Yeah. Paul, Kiran.
Yeah, Anna, one more question is, a mother is asking, who is doing breastfeeding currently, can she take the vaccine?
Yeah, breastfeeding is not a contraindication. WHO recommends breastfeeding.
Okay. Yeah, they should be.
Good evening, doctor. Can I add a question?
Yeah, please.
Yes, please.
Yes, sir. I want to ask you if anyone is a lady, if she is pregnant, she can take the vaccine if she wants to take vaccine, COVID vaccines. Can it is safe for her?
I think currently the available data doesn't say anything, because pregnancy is a special condition. Yeah. That data doesn't recommend vaccination during pregnancy. Okay, so that's what we can say.
So it means she cannot take if she is pregnant.
I think that's what it's.
We don't know. Yeah, it's difficult. We don't have answer, have any recommendation because this is a new disease.
So it means we don't know properly whether it is safe for her or.
Yes, exactly.
It can be effective.
Yes, exactly.
Yeah. Okay, sir. Thank you. Thank you so much, sir.
And one more question. There is a person asking buccal carcinoma patient. Yeah. Asking, can they take the vaccine? Scared of taking the vaccine because of the complications.
Yeah, they should be able to take the vaccines. I think these are the patients who will actually, if they contract the disease, the severity may be more because their existing immunity will be less. So even if they get the infection can really flare up. The only thing, if the patients are already on immunosuppressant drugs, those are the patients who may not mount immune response adequately, so that they'll have to speak with the individual caregiver, doctor, and then take a call on vaccines that time. But I think other patients should be able to take.
Yeah, I think we covered most of the questions, Anna, directly or indirectly.
One more question.
Paul,
people are asking. Sorry.
Yes, go ahead.
Mahindana, shall I ask?
Yeah, that is about the CBNAT. Please go ahead.
CBNAT. See, all that are the rapid test. It at least takes like 48 hours and 24 to 48 depends on the the load of the samples because there are very many load.
Yeah.
So like the TrueNat, RT-PCR, INAT, all of them are similar tests which can give a faster reports.
They're all PCR tests, and it all depends. For example, currently the load is so high, and the people in the lab, they became positive. Now, Anand lab, RV lab, everywhere, they don't have people to do. That's the reason it's taking more than 48 to 72 hours. I mean, in a normal scenario, if the load is not too much, they should be able to give within 24 hours. And the INAT will give within 1 hour, the one which we do in the airports, no? The similar thing. We also have that thing, but we are using for the select people, for screening in the emergency area.
Also, one more question, Anna, regarding the Parkinson's patients about the vaccine.
That's not a contraindication. They can take the vaccine, no issues.
Okay. And if anybody is suffering with filaria and the drug reactions are there.
See, that's what, if a patient have multiple drug allergy histories, I think they will have to discuss with their treating doctor and then take a call on it, because it will still be an informed decision where the patient also takes responsibility for themselves when they take any medications. Because if they have multiple drug allergies, no one can tell whether they will be allergic to the vaccine or not. So that is a clinical decision which the patient and the doctor will have to take a decision.
Doctor, one of the brother asked if he is suspected. So you told him to go for screening. Screening means HRCT or HRCT or X-ray.
So, even the day one of, even if they suspected or they come in contact with the COVID patient, doing the HRCT test on day one is not useful. It will come as normal or just mild. I would rather do HRCT when the symptoms are increasing and worsening, so that we get additional details on their lung condition and their status.
Doing a CT will not tell you whether you have infection or not.
You cannot rule out COVID just by doing CT.
Yeah. So it
So
is
when he should go,
recommended on day one or day two.
Some of the patient I have seen, their SpO2 saturation was okay, but still they are getting fever, and some of they are getting weakness and joints pain.
It can be a mild COVID.
So in that case, in that case, he or she should go for the screening of X-ray and CT.
See, generally when a disease starts, the first week you have the viremia, the virus will continue to multiply.
Yes, sir.
In the first week of the illness, the viral infection, you will not have involvement of the lung. Okay. Generally, the involvement of the lung happens towards the end of the first week and the second week. Okay. But you need to understand when you develop the first and the fever are the symptoms, day one. Sometimes you may not have fever on day one. It could be mild myalgia, mild fatigue and tiredness. Okay. So some people, they may not recognize any symptoms. They might have some fatigue, but when they check the saturation will be low, and you do a CT, CT will show florid disease. But remember, this person will be having the symptoms for more than a week's time. And now if you do a CT, it is showing, the involvement of the lung. So day one of the symptoms, the first week of the thing is not an indication, is not the indication for you to go for a CT scan.
See, day one of symptoms, having body pain, joint pains, all that is considered as day one of symptoms. Fever may come after 3-4 days.
But even a mild myalgia or fatigue also is a day one, so you need to understand that.
Some of the patients, sir, I have seen one of our friend, he got the fever and joints pain. So he went, after 3 days, he went for the blood investigation. So because he was thinking that he is getting a viral or he should go for the fever test. So it will be, that test is valuable for this in COVID.
See, within 3 days, as I told earlier, it may not add much information. It's just the baseline test.
Is it the blood test or
blood test?
Is it the COVID test or the blood test or the CT? Which test is that?
Sir, it's a blood test. He went for the blood test, fever.
Okay. Okay, it's not the COVID
fever profile.
Okay,
See, I think it will be more like a baseline test where you use it to compare when you repeat the blood test, say 72 hours later. And if the symptoms again changes, even within 2 days, we may need to repeat. So I think it's based
on. So if it is within 3 days, it will just give us the baseline data.
Compare later.
Yeah.
So sir, it means after 3 days only we should go for this blood test or an.
See, it's very difficult to give a day time because see, every symptom, every patient will be very different. Now,
Yes,
say a
sir. Yes,
patient
sir.
with kidney disease and heart disease comes, or even just say with a fever, with a urine infection, with a diabetes. I cannot say day one I will not do blood test because they may be having infection because of the urine infection.
Yes, sir. Yes,
So
sir.
it depends on the patient.
Yeah.
But in
Yes, sir.
general, if it's just fever, the first 1 or 2 days of symptom may not give much information.
They're really not
Okay.
required.
Yeah.
Okay, sir. Okay, sir. Thank you, sir.
Sure. Thank you, sir.
So Anna, there's one more question. People are asking if they've already gone in for the first dose of the vaccination and then they still feel that the mRNA vaccination is good, can they have that as their second dose if it's available?
I think mixing vaccines are not recommended because we do not know how the immune response will be. So it's always advised that the first dose you take, you go. The second dose also is the same vaccine.
That is the right thing to do as of now. Maybe next time.
Yeah,
they
because
can switch
in
over
case
and,
the vaccine immunity comes down, and if possible, you can take a vaccine change different.
maybe
change
after a few
vaccine.
months later on or
But I
something
think
like
only
that.
time we'll have to
Yeah.
wait and see.
But the recommendation is that if you have taken one dose, you have to take the same thing, the second one.
Okay. Thank you.
So, sir,
And now one more, please,
sir.
Mehta, please,
Sorry,
Mehta,
sir.
Mehta, please put on hold for a minute. Okay. If you have any questions, please put it in the chat so that it will be easy for us to ask and moderate the questions. And one more question is present situation in Bangalore. Many patients are moderately affected. O2 level is going down, no hospital beds, breathing exercise is 1 point. What else can be done till we get into the hospital? I think you already answered, but you can reiterate.
So awake prone breathing, okay, incentive spirometry, and if you have if the saturation is coming low, or else if you have any signs of worsening, starting the steroids, okay, at home, dexamethasone 6 milligrams, okay, and then once you start the dexamethasone, you continue to monitor the sugars with the glucometer, okay. So these are some of the things
I
that has
think
to
you
be
can
done.
start it at home, but after some time you'll definitely have a lot of confusion and doubts at home.
Yeah.
You will need someone's help, either like a e-consult or a teleconsult or visiting the hospital itself only, I think will help.
So in case if you're not able to get the bed, you can start off these things, okay, and then take the teleconsultation. BBH, now we are offering the teleconsultation. There is for the COVID patients, we are offering the wings of care. This is not a business promotion, but at least they'll be able to monitor, and then see what need to be done. What is the best possible thing that could be done at home, when they don't have the bed in the hospital. Yes.
One more thing regarding the home, I think whoever can stop smoking should stop smoking. Whether it's for COVID or not COVID, I think I would still encourage people to stop smoking.
And then the inhalers.
Inhalers, if they're already asthmatics, they know how to take the inhaler. They can even take it like double the dose, and it's still breathless. They will have to come to the hospital. Regarding the technique, first it's like an L shape. We'll need to mix it because there are a couple of medications in it. Mix it, breathe out. It needs to be synchronized. So when they are breathing in, just press it. It's called activation. When you do that at the same time, take a deep breath and hold it for like 10 counts and then slowly breathe out. Wait for another 30 seconds and then take the next dose. The common ones which we are using is the combinations with formoterol and ipratropium. There are different brands which are available. So I think starting that also, budesonide are the common ones.
Seroflow, budesonide. These are all. These also will help.
These things also will help in. But the technique of using the inhaler is very important. Nebulizations we don't use much often because again aerosolization, spreading to family members.
At home, it will be a potential spread, everywhere when you use a nebulizer at home.
Okay.
And also you need to rinse the mouth after you finish using the inhaler. I think that's also important.
Maybe last couple of questions, Anna, before we wind up. One is, will taking vaccine, will it decrease the immunity? That is one question. And one more brother is asking that he has a fever and other mild symptoms with O2 above 97, age 33, he's tested positive, but D-dimer was 650 on 9th day. So he's a little bit worried. Will there be any complications with respect to blood clot or something like that?
See, I think, as I told earlier, DMA is an inflammatory marker. If they don't have any breathlessness, the saturation is fine, they will still need to focus on the awake proning exercise. They can take the supplements. But any change in the saturation or drop in the saturation, they can do the 6-minute walk test. It's had a lot of clinical information on the patient. Walk, just briefly walk, maybe thrice a day. Just walk 6 minutes and then check the saturation again. If there is a drop in saturation, I think they will need medical help. Staying at home may not help. But just seeing one value and telling it is dangerous, I think it's difficult to say. Maybe part of the fever itself, the values can be high.
Yeah, thank you. Devi, Mahindana,
think
do
we
you
can.
have any questions further?
Can we ask one last question and then stop?
Yeah.
Because I think we are really, even our doctors are taxed and yeah, and they've given us 2
So
hours.
please go ahead.
Okay. So one person's asking, how long will breathlessness continue after they have recovered?
I think it depends on the involvement of the lung. Patients with severe, even after 3 months, they come with breathlessness. Many of them, like they've taken like even a few months to wean off their oxygen. There are a couple of patients who've taken even like 3 months to go and reduce the oxygen. But what I've noticed is when they walk, they're still breathless. Their oxygen may be normal, but they're still breathless. And again, I think the breathing exercise will definitely help them on the long run. So it depends on the involvement of the lung and their underlying conditions. See, say the patient is already obese. Now they are already, their breathing efforts are going to be compromised if they have asthma or an underlying lung disease. So there are many factors which can influence the recovery of the patient.
Thank you. And he is asking if there's any service that caters to people who are homebound, if there's a drive to go and vaccinate them in the house.
I think
I can go over
currently it is not there. Even the vaccine that we are getting is from the government. Okay. So, and that was stopped 2 days back. So the official supply from the government has stopped. So they told us you need to procure from the suppliers and then make it available. We do not know when we are going to get the vaccine from the suppliers. That is the status as of today. Yeah.
Okay. Thank you.
Yeah. Any other questions, Devi?
I think we can stop because we tried
Yeah.
to cook everything that's general rather than very specific, which they can have, with like for a doctor consultation.
Yeah.
So sorry, sir. Can I ask last question, please?
Yes, go ahead, please.
So one of the sister was there. She already has taken co-vaccine. She took the first dose, but the time already has passed, and she was not getting that same dose. So vaccine, she first time she got vaccinated with co-vaccine, but now the co-vaccine is not available. So can she or he will go for COVID shield?
No, they have to take vaccine only.
Co-vaccine only she has to take, no, sir?
Yes, yes, sir.
Yeah.
Okay, thank you, sir. Thank you. Thank you so
Yeah.
much.
Anil, you have raised, I think we can take the last question and wind up. Anil, do you have any question, Anil?
Yeah.
Can you precisely ask?
Yeah, Anna. So what my question is regarding the vaccination. So person who are taking cancer treatment or who are already diagnosed, so will there be an effect we can take vaccine or not?
Yeah, I think it's a good thing to take. I mean, for this group of people, if they develop infection, the severity will be more. It is good for them to take the vaccination, definitely. Yes.
See, sometimes they are on immunosuppressants, drugs for cancer, various things. You'll have to discuss with your oncologist regarding this. Sometimes they give a break of about 2 weeks and then you can take the vaccine and then restart the regimen after that. So you'll have to specifically discuss with your onco.
Yeah, the drugs which depress the immunity, like the steroids and then the chemotherapy drugs, even if you give the vaccine, it will not be effective. So you discuss with your oncologist, maybe they might decide based on the disease condition whether they can withhold these immunosuppressive drugs for a short period of time and then give the vaccine. I think it has to be discussed with the treating doctor and decide.
Okay, thanks, Anna.
Okay. There is a repetitive question, Anna. How can we find out that we have COVID if it is asymptomatic?
See, because you're asymptomatic, I think most people may not test. But then if you've had a
Primary contact.
with if you are the primary contact with the COVID positive patients, I think you can check it on day 0 and day 5 of contact. So, and then end of the week, if you're negative, then I think you can get back to your regular work. But then any random person who's asymptomatic, just testing it may be difficult to say.
Probably in this group, if we check, maybe few people will become positive, because such is the load, such is the, amount of problem. Yeah, such is a problem currently.
Yeah, also if there are only one single room with the 2 patients, one got affected, right? I mean, in that scenario, what are the
Even
precautions?
during meal times or any time, I think it's always better you to spend as minimum time as possible and keep your 2 meters distancing. Finish eating as soon as possible and wear your mask again. Because many contacts, close contacts, you may think the friend next to you may not have, but then when they develop, then you're already a contact. So those precautions you will have to take.
Dr. Vinod, what the question is, like, if both of them are COVID positive, can they be together?
No problem. Yeah.
Okay.
They're of the same clone, no issues.
Okay.
Okay. I really thank Anna and Dr. Vinod. In a short notice, we are able to handle a lot of questions, and I know both of you are totally occupied, totally busy, 24/7 you're working. We are really glad to have both of you and spend your valuable and precious time. From UESI family, we really thank both of you for your time. And this recording is available in YouTube. I mean, we have already circulated this one, and the link is provided in the chat window. Once again, I thank Spurgeon Anna and Dr. Vinod. Thank you so much, Anna. Thank you so much, Dr. Vinod, for your time.
Yeah. Thank you so much and stay safe, everyone.
Yeah, thank you.
We'll pray that the Lord protect us.
Yes, a lot of comments have come asking to thank you personally. Thank you so much, Anna. And I request Julius uncle, can you pray and close this session?
Yeah. Okay. Shall we pray? Father, we want to thank you, praise you, Lord, for giving us an opportunity to get a clarity from the Spurgeon and Vinod, Master. We are grateful to you a lot. Father, we thank you for all your protection. Lord, when we get something, may we not go into anxiety, panic, or depression. May we be able to get the clarity from the efficient people, and we may be able to trust you. And this is the time, oh Master, we bring everything to you in prayer, so that, oh Master, we can deliberately think about whom to contact, how to go about it. And, oh Master, without being panicked, we may be able to go forward. We thank you, Lord, for the efforts of Paul Kiran and the team, oh Master, in Bangalore city, oh Lord, forming the groups for every area, oh Lord, that they may be able to take care of the individuals, oh Master. Whether it is home quarantine or whether to go and get a bed, oh Master, in the hospital, or to get the blood tested or get the medicine or supply the food, we are grateful to you, oh Master, as a fellowship, that we may be concerned about one another during this critical time. We are thankful to you, oh Master. Lord, we thank you for the opportunity. We are able to come together, and we may continue to, oh Master, be focused without getting discouraged, whatever happens, oh Master. And we may be able to help one another and may be able to go forward. We thank you. We thank you. We praise you. Accept our thanksgiving. In Jesus' precious name we pray. Amen.
Amen.
Thank you,
Thank you, Uncle. There are a couple of